treatment decision-making process is a very complex one, because we should first take into consideration all the prognostic factors, clinical prognostic factors, MRI, but also neurophysiological prognostic factors, and more recently also some prognostic factors coming from body fluid biomarkers. From the other side, we should consider the natural history of the patient and also the propensity of the patient to take risks, and also which are the factors that may enhance some of the risks in terms of adverse effects. So again, it's a very complicated type of calculation, but it's becoming fundamental for personalized treatment. This is really the aim of the entire process of treatment decision. The reason of a choice of a given treatment are first to try to minimize the risk, and second to maximize the benefits. So the possibility to minimize risk is clearly there. Again, in order to minimize the risk, we need to know which is the condition of the body in terms of factors that may be in some way factors that may expose the patient to some specific risk. There are quite clear examples. Each of the available disease-modified treatment has some increased risk in some type of population. For example, the fingolimod has an increased risk of ocular edema in diabetic patients and in older patients. Again, for fingolimod, the risk of first dose adverse effect on heart rate is increased in patients with heart problems, in patients taking some type of treatments, and so in patients with natalizumab, the risk of PML is clearly related to the positivity of anti-JC virus antibodies, but there are examples for any of the available treatments. So yes, this can be minimized, and it is necessary to know which are the risks in order to minimize the risk. Well, I think that where we are today with treatment is that we have a lot of possibilities to maintain the patient free from any type of disease-related event, to protect from attacks, to protect from disability progression. That is particularly true for patients with relapsing multiple sclerosis. If we have such a possibility, then we must be able to apply the appropriate treatment for each person. In order to do this not easy business, educational aspects are really fundamental. Meetings like the one that we are organizing here in March are really fundamental in order to increase the confidence of the patient for a better future. Education.